Welcome back to Liquid Lunch, and we're going to talk about craniosacral therapy with Robert Harris here, who is, I guess, one of the founders, or
co-founder of a clinic here in Toronto that's the largest and longest-standing clinic in the country. Yes,
of
craniosacral therapy.
Now, I've heard some great things about craniosacral therapy.
It is tremendous work in that it is quite different than other body works. It still has a desire and focus to assist one to overcome their places of restriction where injury has happened, or where we hold tensions, or surgery, where there's been incidences for the body. And it's utilizing a subtle, tiny movement that is occurring in all of us that we're generally not aware of, in that the fluid that's bathing your brain and your spinal cord, it rises in the amount. It expands and pushes the covering around the brain away from the brain, so it gets a bit of episode of space and relief from otherwise the sac around your brain and spinal cord would always be some pressure against the nervous system. And so to keep it fresh, the fluid that's bathing it at close to the speed of relaxed breathing rises in the amount, and it causes literally a physical movement and expansion of the bones of the head and also the whole body. Because of the pressure on the nervous system when it's going through the fluid build, the body gets slightly excited, and there is witnessable movement that we can track throughout the whole body of it turning out a little bit and then returning as the pressure drops. So the movement leads us to be able to find on somebody where there's trouble without putting the person through pain, without testing an area and challenging the restriction, the limit that there is, that our hands are very gently placed on a person, on their head and on their body, and we're tracking this slight movement, or more so the aberrations to the normal movement, to get steered as to where we go. Now, it's very different. Yes, we're going to go to a restrictive site, whereas some other therapists maybe would go to the painful site. But you could have a place that is your pull, and with an injury happen, but it's affecting at a distance a nerve that's not liking the effect of that anchor. And so we go to where the anchor is as opposed to where the pain is. It's very gentle, and so the recipient really feels this quality of that the therapist is very blended with the nature of what is happening in their own body. And it very much becomes a pas de deux movement response of the therapist feeling the distortions. And either we offer slack, which puts your nervous system into a profound settling. Like when you climb in a hammock, you fall asleep. You cannot finish a book in a hammock. I've yet to meet a person who said, I actually finished that book.
Very true.
And so our hands are like in that region of challenge, offering just the right sense of slack, reading the pulls that are there, and we offer just the right sense of slack, and the body gives us an indicator of when we're doing just the right matrix, there's an instant calm that comes over, and that is the fluid that is normally pushing away this tension that the brain's under. That fluid hovers in the amount, and instead of rising and returning back, and the nervous system, while it is hovering in, not getting pressurized, you drop deeper and deeper and deeper in relaxation. It's like in a yoga class in the corpse pose, where you feel yourself just sink into the earth and you sort of disappear. Our hands are looking to put somebody into that state in offering slack. We instinctually do it too, those moments. You go to take a break and you're trying to think about what is the next thing I need to write about. And we go into this posture of our hands behind our head. We're actually instinctually aiming for two spots that are right the width of our eyes, opposite our eyes, right in the divide. And you'll notice if you put your hands back there right now, that you get drawn to two little sensitive dimples that are from the pull of your eyeballs on this divide in your brain. And when we go in this position, we tend to go off into a daydream. And you'll notice if you moved your hands up an inch or two from where you instinctually went, your brain sort of goes up to its normal level, and go back in those spots, and you feel yourself get heavy right away. We also feel that from a firm hug from a friend. We just feel like, oh, you give over in
Yeah,
their arms.
it relaxes you.
And
Yeah.
also swaddling a baby. That is why a baby goes calm when it is being wrapped, because it is like the hammock effect. And you notice here, yes, so there's very specific spots.
Those are the
there
spots,
you are.
right?
Those ones, yep.
Yeah.
And you notice there's an instant shift. So
Yeah.
we also last year went into high schools to teach students that you can touch your own spots and get yourself ready for the test and get rid of the angst that you're just feeling
I
as
could
the
feel it in
test
my
is
eyes
happening.
even,
You
right?
notice your eyes relax
Yeah.
with that sense,
Yeah,
because
yeah.
that same divide layer in our brain that separates higher and lower, it actually comes all the way forward and it wraps your eyeballs. And it's a source for also why we may get a headache that's in one eye more than the other. And we can test with our eyes. If we look left and look right, if it's easier to look one direction, that's because there's already a pull in that layer. And that can lead to, that's why the headache gets you on the one side, or that you get it through your cranium on this side, because the sac doesn't have the same amount of give. We get people coming in because many times it is physical need, pain, dysfunction, neural dysfunction. We treat everything from newborns who don't latch well with their mother, that feed better on one side versus the other, because maybe their neck has a misalignment and they can't rotate as easily. Maybe the base of the skull got too jammed, and that is a source of colic, or that their tongue control isn't having the suction it should for feeding. A child where it starts with a neck that doesn't turn as easily, maybe later on that leads to their temporal bone not having the mobility, and so then you get the ear not draining as easily, and recurrent ear infections would come. If your temporal bones don't move as well, you could gradually develop jaw tension, or maybe you have a coordination balance problem, because the two bones, as they're being moved by the cranial rhythm, don't travel the same amount, and your head's getting this different sense of what is my sense in the world. But the work, too, has, because we're attuned into the subtlety of the response in the nervous system, we either offer it slack, or we're doing very gentle, localized lengthening to the way the tissues got glued up incorrectly. Rather than just like a massage therapist working a muscle that it attaches from here to here, and therefore you're going to work the structure. A physio will stretch something to bring that about. We listen to and recognize the elastic distortion, and we first offer like microscopic yoga to gently give a lengthening to the tissues. And that lengthening is being done at a load that is below any reaction. If we go to stretch something strong, the muscles automatically tighten up, and we stay below that radar in the body so that we can feel the accuracy of the distortion and work
now, where
with that.
do you work then in this particular case? If I
So-
may, let's say somebody has pain somewhere. I just got a picture that you are mostly working.
No, we're not just on the head. It
here.
has this unique ability of addressing this environment and saying this needs to be a mobile environment, and if it's not, yes, you will get nerve problems of crossed eyes or headaches or jaw acting up. But we got led to this work because of my wife's knee. The two of us went on a trampoline together. We're both massage therapists. We used to do really deep, forceful work to address scar tissue. We went on a trampoline together. We were only just started in the bounces. She was about to voice, "I don't feel secure." She had a funny landing. Her knee buckled backwards, tore the internal ligament, the cartilage. Significant surgery, reconstructive surgery. When she came out of the cast, the knee was really stuck. I was doing deep work on her. Every day she wasn't at physio. She was off to the hospital for physio 3 times a week. She was making only 3 degrees per week with this very forceful, aggressive work they were doing, me digging locally. And we met a craniosacral therapist. Alex had 2 appointments in the 1 week. I didn't do any work. The physios did not do any work on her. And she had 35 days worth of outcome from 2 hours of therapy.
Of craniosacral.
Of cranial being done on her knee, and all that was being done on her knee was following the pulls, and when the cranial rhythm went quiet, the therapist just kept their hands still because the body was giving the indicator this is just the right matrix for me to undo the trauma that's in here. And little tiny other pulls as you get through the layer of an onion, there's another deeper pull, or the body's feeling a sense of trust. So it tends to start opening up to the engagement of the hands, of when it's offering the right nature and the person's feeling the stillness and they get settled. There's this opening of both the injury site to permission to come in deeper, compared to if you were in there deeply and causing pain, it's tightening. You have to work through that tension before you can actually get at the scar tissue. But also, as you're working with somebody and you're in places like in the core of their body, separate from her knee only had the unwinding being done to bring it about. In the core of the body, and when you're also in places where the chakras are, the energy centers in the body, there starts to be quite a strong trust bond between the person receiving the work and the doer. And that quality of a person opening more and more to this dynamic is feeling good. I'm being supported in just the right way, or just requested to be elongated in a way that I can keep my consciousness in there and facilitate what this therapist's hands are coaxing me to do, cajoling me to lengthen. That people very often get in touch with deeper soul elements of issues that they feel they need to also find, how do I bring harmony to this place of discord within me? And the work both enables their consciousness to focus on what do they need, because it's not intrusive, but there's also this natural unfolding as the person's nervous system gets more and more settled. That which is discordant stands out more in contrast compared to this overall quality that's coming over them. So there's a tremendous quality of an unfoldment happening in the course of a session. You watch infants going from being in spastic pain to its softening, and then making eye contact with the parent. Sometimes for the first time also, that these babies have been so distressed in their discomfort. And it's, for an infant, it's like watching them go from this bundle of tension, constraint and tension that you're sort of assisting a flower to come into its unfoldment and its opening. And
I just saw this
blossoming forward.
Beautiful.
Yeah.
What, like when I think of deep tissue massage, I'm thinking you're working on the surface and then go deeper and deeper. Craniosacral, is there a specific part of the tissue layers that you focus on?
No, you can also be going right deep, 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 and be invited down right in against somebody's spine, and that you will. There's a saying in osteopathy where this work came from, that you can never go too deeply, only too quickly.
Okay, so you
and
ask
so
the
if you're
body
gradual,
permission.
Then the body will give you permission, and it can allow you to work very, very deeply within. So it's not just on the surface. Our hands are sitting there on the surface, but we may also, with invitation, be eventually quite deep, deep down structurally inside the person, but never causing the pain or the guarding with it. So there keeps being this sense of, you're right within me, but keep going. I will keep opening and allowing this.
Now, is this in the realm of chiropractic, or?
It grew from osteopathy. It's very different than chiropractic in terms of the approach with how you'll handle the body and the tissues, but a similar goal in help a structure be in its normal relationship, alignment, so that you don't have dysfunction. You don't have something performing incorrectly. So chiropractic will recognize the bone's out of alignment, and we need to get it to where it should be to be structurally integrated and not have pressure on nerves, not be pinching. The difference is we also recognize where that bone needs to be, but we're going to lead the bone over at the pace of the tissues giving us the lengthening and the distancing. As opposed to a chiropractor will say, if we get the bone there, the pressure's off the nerve, the tissue should start to behave.
Whereas you ask the tissue's permission
and we create the release
the
there for it to enable the bone to then achieve its better alignment.
Now,
we don't want to cause new inflammation in forcing an issue. When we worked really deeply in our work, we also had to ask people to please go home and ice this, because we've just, through our deep tissue work, yes, we broke fibers up that were adhered, but because it was aggressive, you need to calm that down. And craniosacral will always come at something where you're not causing pain from it, and where you do not also irritate and inflame the area. So the results are frequently very rapid, very quick changes to headache patterns for people, neurological challenges, babies immediately starting to be able to latch better with their mom.
Now, with those babies, for example,
Yeah.
What is the reason for them being less than optimal in the first place? Is it a birth trauma of some sort, or
sometimes it's even just the position in utero. It's maybe not that it was a difficult birth, it may have been an easy birth, but sometimes the babies have dropped early and they've maybe been descended in the mom's pelvis for the last month. And with the head in the one fixed position in the canal, in the beginning of the canal, there's tremendous torque forces on their neck.
Right.
And so the ones who have dropped early frequently are being born with spasm on one side of the neck, because they already were in the canal or in the pelvis with a kinked position there. But certainly a birth that is very forceful and difficult, where maybe forceps are being used to help get the child out, or a vacuum is being used and bones consequently getting pulled into a missed position, or that it was a very long, hard labor and a lot of molding on the cranium. So birth is often the first source of us getting compromises into us existing as a symmetrically capable, mobile structure. And also, too, with newborns, many a times a parent will say, oh, you know, my newborn is born very developed, they're holding their head up, but at the same time they're fussy with shallow sleeps, not feeding well, they maybe bob on and off with the nursing, they're not comfortable, they're not being consoled. And the tensions that can be in there can also self-perpetuate in that kind of arching that a child goes through while they're allowed to be this child with this strong neck. In fact, it is causing neural troubles for the nerves. That's digestion, that's also the control of your tongue, that's also the upper neck muscles, that just that position of the head going back is something that can perpetuate the problem further.
And yet
and
the
it can lead to the little ones already, and they get habituated to it. They also, it gets them stuck in alarm response, and it can pave the way to a child who's initially fussy, has a greater tendency to being hyperactive, having attention deficit. The pulls here, and we often feel that if we're doing a lot of work and we're in forward head posture, the tensions we'll get in our neck, they also pull right through the divide of what is supporting and separating the two halves of your brain, that really neck tension gives us a vulnerability for frontal headaches and sinus headaches in the child and in us too. Pressure on your frontal area is where your short-term memory is. It's where your socialized thought happens. You're responding to your environment and communicating. And so these children who have hyperextensive, high-toned necks and challenges here, often too are the ones that in the playground have the disproportionate reaction when somebody butts into the lineup for the slide, and the next thing they're just plowing that kid because they're a system that's already under alarm dominance. And the most ideal for us all would be after birth if we could get assessed and checked to help undo forces that happened initially in that entree into the physical world.
That's great to know that, you know, that maybe every parent should consider bringing their infant to...
It would be a tremendous benefit and long-term benefit, but parents also will gain a lot of benefit for their kids, for little infants, by actually, rather than allowing them to arch, holding the child such that their back is against the parent and a hand on the chest of the child, so that if they were pushing with their head, they can't still arch themselves and cause the further jamming. And while the hand is there on the chest, the other supportive hand gradually moves their their backside, their bum away from the holding person, and you bring on a fetal curving of the individual, and the nervous system starts to settle because you're offering a gapping to the excess excitement that's happened through the position causing pressure.
So when you're doing this work, either with an infant or with an adult, are these, you're bringing long-lasting changes?
Yes, our goal is long-lasting. When we did traditional massage, we started to feel like our hands were just manual Valium for the person, that it was just calming something down, but it would tend to come back. Because we stay on tissue, not to just feel it turn relaxed, but we want to feel that elastic distortion go from there. We stay with releases until there's a viscous liquid-like level in what we're perceiving with our hands, versus there still is an elastic compromise and anchoring there. So we tend to not keep seeing people for ongoing care. Instead, we get them over the hump of their complaint they're coming in with, and when their system's mobile again, we tend to say to them, there's self-care things that you can do. You can cradle yourself, and we make 2 soft adjustable balls that people can use to set up bringing yourself into that stillness. We also make another device that's got 6 balls in it, but you use it along your spine, and it will cause an opening through the ribs and a distancing or a decompression. So we'll look to get people doing self-care, do these things to help with what stress does to your body, or to get releases separate from the time you're with us. But it generally is that it's not ongoing care, it's really getting somebody over, getting lasting results, getting it to really turn liquid in that area.
Now, are you mostly, the name cranial, but you think of the head? But
yes, you think of cranial, and that it would only be work up there. And when we got led into the work, we had heard of some other massage therapist colleagues who had gone to Michigan to take this training that was starting to be offered outside of osteopathy. And Dr. Upledger was the person who helped popularize it in the 70s of making the work available. But the work has initially, with it being in the cranium for its naming of it, that is where the sac that is surrounding your brain and your spinal cord has its only attachments, physical attachments, is to the bones of your head and then down at your sacrum. And the initial work was seen as that we have this unique handle to come into helping this environment become more pliable, and that the bones of the head and the sacrum were ways to get that environment to become mobile like it should be. But it was discovered also that the cranial rhythm goes quiet when you're offering the right hands-on work anywhere in the body, and also that there was movement witnessable beyond just the hydraulics in the head and down through the spine. So the work over the years has grown into, like osteopathy, addressing mechanical challenges anywhere in the body, restrictions, helping to normalize it, but really reading the subtleties of this fluid dynamic of both what it keeps offering as a movement assessor, but also the indicators it gives you when you're doing the right thing. When you're doing something, the body says, yes, that is just the perfect matrix to hold me on. This is matching the position they found me in my accident. This is taking a pull away from an area that's developed into restriction, and it's always been bringing on irritation because of that pull. You offer temporary slack, and the cranial sacral rhythm, that fluid dynamic that is fluidly driven in that environment, no matter where it is on the body, it will go into a quiet when the body experiences a sense of slack. The slack physically, but also we get little moments of that relaxation too, that neural shift. If somebody with an emotional issue, you had some difficult words with a friend, and then you went to talk about it, and the friend said, oh, I didn't mean it that way. If they cut you some slack on an emotional thing, you feel an immediate easing in your sense of being. Also mentally on a project, if your boss says you've got an extra week on the deadline on this, you also feel this massive bodily felt sense of relief, like a deep sigh, occur when this stillness is occurring. The craniosacral therapist becomes capable of really accurately reading those timing indicators of the hands first get trained to follow little micro sensations, which we already have built in us. We have a nervous system that's meant to be perceiving the world, but we're mostly up in our head so much, and it's hard to be an embodied perception, because also, you know, the body is this great place of mystery, but your head is what tells you everything and where you trust, and, you know, something has to make mental sense. We take people into a place of awakening their physical sensing, and with that heightened sensing ability, then applying that to also reading these indicators that the nervous system gives of the stillness or an energetic stillness also.
You've got to have real subtle sensitivity and subtle ability to...
It's trainable into people. So it's very much a matter of taking people into a place where their mind can calm enough that they can then, with that quieter mind, focus by choice on one particular realm of sensation or another realm. When we go to awaken a therapist's hands to energetics, we get settled first, and then we use some things as an experience to perceive a strong energy field. We'll use magnets, or we'll use a cell phone, or we'll use a piece of fruit, contrasting kinds of things. And the person realizes that as their hand moves over those objects, when they're tuned into what their nervous system baseline is, as opposed to they're up in their head, when they've got a sense of their felt self, they realize that there's a perceptual difference that starts to resonate in them when their body is close to a concentration of a type of field. So we use that process of the stillness you can bring on by touching these spots. We will use that as a method to get people's minds, the trainees, into a place of being consciously settled and out of the activity of the thought realm and various things of the posturing with their mouth and their tongue, and not have their tongue pushing against their teeth or glued onto the roof of the mouth that's stirring the nervous system more by the pressures that are occurring. So we'll take people into a number of various entree exercises to get them capable of perceiving. I left teaching for the Upledger Institute years ago in '98 and continued to teach with the desire to enable parents to right away be able to learn, what can I do, because I've got 24/7 access to the child. I wanted to train parents, as opposed to being dependent on the session, autistic kids coming in and then their behavior is really off in the session, the parents like just enraged about, come on, you know, we drove all this way, and we witnessed these, you know, difficult scenarios where it made me realize I want to be able to get parents able to have their hands affect change right away. And so it took me stepping away from the people that trained us and that we became trainers for, with witnessing how it is possible to, rather than have somebody do course after course after course after course to get the skill, instead I first wanted to get them sensitive, get them capable of perceiving, and then you wouldn't have to do as many courses to keep being in the variable experience, that the dynamic would be way more witnessable right away.
Well, we lost this intuitiveness, right? In
yes,
this part of the world, and as a mother of 4, I had a complicated experience too, where I needed to be learning to be still so the child could actually then get in step with my energy also.
Yes.
Now, will this work also for, like we talked about, the trauma, the young boys who had trauma, PTSD or urban disassociation?
Yes, it can, because both in teaching individuals how they can settle their nervous system electively on their own, like we did with going into the schools, of really being empowered that, yes, we passively go into this position, but you can use that to your value.
Right.
I was using it just before coming on right now and settling myself for a moment, knowing my time was coming up. So that is one thing, but also the hyperextensive element that is often in there that is making them more reactive, easier to be in rage, to address those restrictions with them and to help take their nervous system out of being stuck in a sympathetic drive, which is fight or flight, and to open up and give them also the value and actual time in restorative function, in the counterbalance, the parasympathetic. So addressing trigger zones in the body, down the spine where there's misalignments, and those misalignments maybe are keeping their breath shallow, and then that's adding to anxiety being felt within them, bigger amounts of fear, more reactiveness. So it will be good to network with Dynamo entrepreneurs, in that there's empowerments that I could also bring to them that they'd be able to utilize in those times with the youth, and feel that it's not just all necessarily your mental attitude or your behavior, but what else is, as a physical trigger, putting you into that kind of behavior.
Well, thank you
can
for
actually
pointing out how early it starts, even.
Yes.
As young as a baby.
It really can, yeah.
That is just incredible. So I find it always very humbling to see how the guests that come to our show all seem to also fit together.
Yes.
Even though it was not intellectually intended to happen.
Mm-hmm. Mm-hmm.
So it would be really nice to see you relate.
To see that,
So who and how can people contact you? Is it anybody with pain, or anybody with emotional upset?
With pain, with emotional upsets, with neurological challenges, with learning disabilities. Really, many of the people who have come to us have been the road of investigation and MRIs, trying to understand why do they get this focal point of a migraine headache, and the MRI is not showing something, and our hands right away will ask, is it right over here where your pain is? It's very evident in terms of the lack of mobility. But people, yes, they can come to us really, they come with every complaint of either pain, restricted mobility, restricted movements, neurological challenges, particularly of the head, face, and neck, because of this unique ability to address the mobility in this environment, that really the neurologist is addressing issues for the head, or the dentist is, and ear, nose, and throat. But many a times they're really looking for really significant things. So our practice is really open to anyone. You don't have to be referred. We're massage therapists, all of us. There's one who is also an osteopath too in the practice. We're right downtown. We've been downtown for 29 years. We are over at Duncan and Adelaide. We're near Metro Hall. We're just north of there, and I also do teach, and there's training courses that families are welcome, the caregiver is welcome to come in. It's about a third that are lay people who are in the training, and the other 2/3 are massage therapists, physios, occasional chiropractor. But craniotherapy.ca, our website, so you can find us through that. And there's 8 of us, I think, in total. There's 5 rooms that we have, and we established this center in '87. My wife and I took the training in '86, right after her knee incident, and witnessing the value of it. We took ourselves off to Florida to the next training course that was available. And as teachers for Upledger, we got moved all around the world to teach, and which was great and enjoyable to have some travels combined with work, and to keep spreading the work also.
Wow.
And
it sounds really cool.
You're kind of sensitizing the world too, because you mentioned earlier we are so top-headed in the Western world. Many of us don't even know how to feel in our body anymore. So thank you for bringing that into the world for our audience today as well. And I look forward to hearing from you. Is there when is the next workshops you're going to have? Do you have any in the new year?
Yes, there's a workshop in early January that's a one-day, and it is a self-help, and it'll be up at DuPont and Spadina. We sublet the Sutherland Chan Massage School to be able to have an easy environment for presentation and people laying about. on the devices besides the self-help, but we learn how to use the balls, the back balls, but a number of other health tips that really come from respecting that quality of how are you going to engage with the body, teaching people a new way to stretch, getting them sensitive to the buzziness that happens when they're being too forceful. And then there's also a shorter 2-hour workshop in February that'll be out at a yoga center at Islington and the Queensway Bodhi Tree.
And this will be on your website,
And that's
I
on the
assume?
website,
Yeah,
yes.
so people could just
and
check
the one
out
out
your
at
website.
the yoga center, I think we call that one the ultimate Shavasana, finding your still point, learning how to bring that response on, and people witnessing, yes, you virtually go liquid while you're in that state.
Well, it's about time that we learn how to use our body.
Yes.
I want to go
Use
liquid
it to
right
roll.
now.
Yes, well.
Liquid lunch.
There you go, liquid lunch, yes.
Thank you. I
You're
will
welcome.
remember that.
Yes.
And
Okay,
yeah,
thank you.
for being here. And if you are interested in learning more, please get in touch with Robert at www.craniosacraltherapy.ca.
Yes.
And thanks
Okay.
again for being
Thank you
here.
very
And
much,
hopefully
Hildegard.
we
Thank
can
you,
have
Hugh.
you
Thank
over
you.
again.
Yes, be
Yeah.
happy to. Yes,
Awesome.
Thank you.
Great to have you on. So let's take a little break, Hildegard. We got a little bit more left on the show today.
We come back with one more guest, so please stay tuned.
Thatchannel.com.
See you later. Place in space, means peace. See you later. Place in space, means peace. See you later. Place in space, place in space. Place in space, means peace. See you later. Place in space, means peace. See you later. Place in space, place in space. Place in space, means place in space, means peace. Damn right. Place in the space.